London has always been one of the world's great medical centres, where many of the most important advances have been made. And with 98 hospitals and 8 medical schools, London has some of the world's leading consultants and medical professionals. The 6 HCA hospitals in London play a vital role in maintaining London's worldwide reputation for healthcare. All of them are centres of excellence in their own right, with international reputations in cardiac surgery, oncology, assisted conception, obstetrics, pediatrics, orthopedics, neurosurgery and rehabilitation. And they all benefit from being part of Hospital Corporation America, which also owns and operates 162 hospitals and 113 surgical centres in the United States. HCA in London has some of the best intensive care units in the private sector, located within the clinical centres of its hospitals. It also has a network of diagnostic clinics conveniently located around London. Underpinning all this work is a group-wide commitment to the very latest diagnostic techniques and imaging technologies.
PACS is a system that allows X-rays and scans to be put directly onto the computer hard drive, which can be accessed from any desktop computer in any of the hospitals that HCA runs, and means that I can then see my patients upstairs in the consulting room and instantly have access to the images that they've had here or in any of the other hospitals in the group.
HCA's 2,500 consultants are drawn from London's leading teaching hospitals. They're carefully selected specialists at the height of their careers, with outstanding records of successful outcomes. And at HCA, they're backed up by highly qualified healthcare professionals and support staff.
To attract the best doctors, you need the best facilities, you need the latest state-of-the-art equipment, and you need the best staff. And we have that here. So we're proud that we have a great portfolio of doctors. The relationship between management and doctors is seamless. It has to be.
One of the benefits of being an international group is that HCA is able to keep investing in the latest proven equipment and facilities, improving the speed and accuracy of its diagnoses and reducing the need for invasive procedures.
A perfect example is our investment in cancer that's going on right at this moment. Over the next 9 months, we'll be investing £24 million in our facilities. At the end of that 9-month period, we'll have the most technologically advanced cancer network within Europe.
Recent acquisitions include the launch of a new robotic radiosurgery system called CyberKnife, designed to treat tumours anywhere in the body non-invasively and with sub-millimetre accuracy.
The CyberKnife is extremely clever. The computer apparatus is able to anticipate where an object will be a latency of some milliseconds later, and so arrange the beam orientation that it catches the tumour at the time the beam will reach the target. The respiratory cycle is patterned and tracked by the computer, and the patient lying on the couch respiring normally, the pattern is memorized, the tumour is tracked, but the ability to track within the body with patient movement due to physiological movements is a very clever advance.
The same high level of investment in new technology is evident throughout the group in the latest fluoroscopy, MRI, and 64-slice CT scanning, cardiac monitoring, and digital mammography. For instance, HCA's London Breast Institute now has the pioneering Suros system.
We were lucky enough to have the first of its type in Europe, which is a vacuum-assisted biopsy technique. It's the Suros device, and what it does is enables you under local anesthetic with a little nick in the skin of about 3 millimeters in size to pop a needle in that actually vacuums out areas of breast tissue. And you can use this for diagnostic purposes. It's very good for areas of calcification in the breast, which might represent pre-malignant change, gives you an extraordinary degree of accuracy, not achievable previously without actual open operation and general anesthetic. It's also brilliant because it enables you to take out small masses in the breast without surgery. You just vacuum them away. Why would you want to go into hospital, have a general anesthetic, spend a night in, have a scar on your breast? Why do that when this technology enables you to walk in with your lump and walk out half an hour later without it.
All the HCA hospitals in London have 24-hour-a-day access to the group's own high-specification pathology laboratories. With 30 biomedical scientists and 12 consultant pathologists, HCA laboratories provide rapid analyses of samples and send the results instantly to the medical teams on the wards.
The entire system is organised around quality, and quality for us means getting the right result to the right place at the right time.
All this technology and expertise ensures that the proportion of successful outcomes from HCA hospitals is unusually high.
And you come here with your patients and you can practice medicine as it should be practiced, without the restrictions that are imposed elsewhere. When we're diagnosing coronary disease in the cath lab, we can see things with this high-resolution flat plate technology that maybe 4 or 5 years ago you couldn't see. The resolution of the images has now gone up. The technology and the physics has evolved to such an extent that you can see the tiniest arteries that you couldn't see before in stark relief. You can see narrowings and blockages in arteries maybe 1 millimetre or 1.5 millimetres wide. You can actually see blood clots as opposed to just narrowings, and all the time with a lower radiation burden to the patient.
Atrial fibrillation, where you have sustained but irregular palpitation, which is the commonest cardiac rhythm problem and also one of the commonest causes of stroke. I mean, one of the reasons it's so exciting being involved in this field is that up until 5 or 6 years ago, atrial fibrillation was considered incurable. So to have patients come to you and walk out of your office at the end of your treatment program cured is such a satisfying thing, both for you and for them, because they also thought it was incurable and their doctors thought it was incurable.
Orthopedics has long been a centre of excellence within the group, with leading specialist spinal, hip and knee surgery and physiotherapy services. There's also a group-wide sports injury service with hand and wrist and foot and ankle clinics. The Assisted Conception Unit is recognised as one of the leading centres of its kind in the world.
We have not only the largest IVF program, but certainly the biggest egg donation program in this country. And IVF is a journey, and you need to be with them in that journey. We need to treat our patients as they are, not as we would have liked them to be. Some patients come with the wrong hormones. Some patients come with less number of eggs than others. We believe that we do not need to screen patients out of treatment, but we treat our patients as they come to us to help them to achieve their long-wanted baby, if we can, and if not, at least we have helped them to try.
At the Portland Hospital and Harley Street Clinic, obstetrics and paediatrics are fully integrated.
The two biggest problems that I would look after in pregnancy are women who have high blood pressure in pregnancy, which is what complicates a lot of pregnancies, and women who develop or have diabetes who get pregnancy. Both conditions require mothers to be monitored very closely during pregnancy, regular visits with an obstetrician, somebody that they get to know well, who has the skills to look after them, to monitor their condition, to make sure that there's not developing any complications, and also to ensure that they're delivered at the right time. So they will need to be scanned very regularly, and that type of scanning needs to be done by somebody who has skills in that area.
It is a very consultant-based service where people are seen by highly skilled and experienced consultants with huge expertise who can make an earlier diagnosis.
HCA provides a complete neurosurgery and neurorehabilitation service for brain and spinal patients.
For spinal surgery, we're using a system called Metrics, which is a system of probes that will progressively open up a track to get us to the spine, often being able to remove a disc through an 18mm incision. So the patient is up and around the next day and home within 2 or 3 days of surgery.
Beyond surgery, the unit provides a full range of intensive rehabilitation programs for stroke and other brain injuries.
We have individual clients and a team will be assigned to them, physiotherapists, occupational therapists, speech therapists, neuropsychologists, nursing team, and myself as a neurologist. And we, together with the patient's family, will plan their care and try to deliver the goals that they set for their rehabilitation period. For example, following a stroke, when they're through the acute period, they're no longer medically unwell, and they can engage in intensive therapy on the road to getting better. There's very good cooperation between us as a group of neurologists and neurosurgeons with the management of the hospital and the management of HCA, who we have regular business meetings with. So we really feel that this is a process that we are involved in developing here, and that's why we provide, for example, a 24-hour, 7-day-a-week on-call neurology consultant rota here to deal with emergencies that might need to come in through the hospital.
Maintaining the highest standards of patient care has always been integral to the HCA philosophy. To ensure continuity of care, HCA has introduced modern matrons throughout its hospitals.
The modern matron will see the patients every day. They build up a bond, a rapport with them. Any problems that they have are dealt with at the point of contact. That personalised service that the modern matron can provide by meeting the patient individually, getting to know them, getting to understand what their needs are, is really, really important.
All this means that HCA provides more than simply the best medical services. It ensures that every patient and all the friends and family members who visit them are as comfortable as possible. For its corporate clients, HCA has introduced Platinum Choice, a range of benefits including door-to-door chauffeur service and special medical and screening packages. HCA's record of successful outcomes makes it the natural choice for almost any complex medical procedure. But statistics only tell part of the story. Besides outstanding medical attention, HCA gives all its patients the understanding and support they need at this important time in their lives.